probably know, Consumers for Affordable Health Care is Maine's health insurance consumer assistance program, and as such, we want a toll-free helpline where last year we talked to over 7,000 people, or fielded over 7,000 calls from readers to talk about health insurance coverage. But many, 25% of those calls, also talk to us about affordability issues that they're having, accessing the health care they need. And we're fortunate that this legislative session, there are a few bills to start trying to tackle the issue of medical debt, to bring relief to many people. One of them, the folks in Health and Human Services heard last week at a public hearing that would increase financial assistance through hospitals up to 200% of the poverty level. And what we have seen in Maine is that, you know, all our hospitals are nonprofit hospitals, and they're doing a tremendous job, and they continue to do a tremendous job, even with the COVID epidemic. But since we have expanded coverage through the Affordable Care Act, and with Medicaid expansion over the years, nonprofit hospitals, which are required to provide some sort of community benefit because they don't pay taxes, for example, what we have seen is the amount of free care that they've provided in millions and millions of dollars has actually decreased by millions of dollars over the last several years, and that medical debt has, in fact, unfortunately increased. So fewer people are getting free care, but more people have medical debt under the Senate collections. Our survey showed that in fact, almost half of adults in Maine carry some sort of medical debt. And when you look at the contributors of medical debt, the majority of those medical debt comes from lab services, diagnostics, emergency care, surgery, services that are routinely provided at a hospital setting. We heard through our survey that people with medical debt, 6 out of 10 experience severe struggles. Some experience difficulties paying for basic needs like food, shelter, and heat. Others have had to use all or most of their savings to help pay down their medical debt, or they've unfortunately incurred additional medical debt through credit cards. And some of the bills that we're working on this legislative session are working to not only provide more transparency, but to provide better consumer protections for people who are forced to use their credit card in order to access healthcare services or pay down their debt. We also hear, this is no surprise, but we heard through our survey that people with medical debt actually put off going to the hospital, seeking the care they need, even when they're in pain or discomfort, because they're worried that medical debt is just going to increase. We also heard that roughly 69% of people with medical debt were not aware that hospitals in Maine were required to provide some level of free care, and that was frustrating. And the majority of Mainers who were surveyed, 93%, 74 to 93%, support initiatives that would help address medical debt in Maine. And I won't get into the specific details of that, with the exception of saying there are some bills. One of them we heard in the HHS committee last week that would not only increase the threshold of free care offered, and most hospitals are already providing that, but it would reduce barriers that people face applying for free care in our state. There are a couple of other bills that the Senate President is sponsoring, and Senator Mike Tipping, to deal with the reporting of medical debt to credit bureaus or selling off medical debt, and to also provide some consumer protections around credit cards. So I know that there's not a lot of time, but that was sort of my spiel. Hi, Representative Graham. Chuck Bell's here, and I know that you need to get to committee, and some of you need to caucus. Really appreciate your coming here, but just want to introduce Chuck Bell from Consumer
Do you want to
Reports.
see if there's any questions?
Yeah, any questions? I know I went through that really quickly. And this setup of this room isn't great for a presentation, but yeah, appreciate your coming.
Yes.
Oh, hi.
Do you have a list of those bills you're referring to anywhere in here, or you can email us maybe?
We will email them to you. Yes, one of them is LD 1955, and the other two bills were just printed, or maybe one of them wasn't, which is why I didn't get that.
Yeah, that would be great.
Okay, great, thank you.
Yeah, I'll be right back.
Well, for anyone who has a few more minutes, so I can give a little bit of national context for this problem, but I think one of the things that's challenging is to get your brain around like how pervasive and widespread it is. And our national number for medical debt is about 41% of US adults have medical debt, 100 million Americans. So it's much more pervasive and widespread than many of us may realize. And a lot of people who have medical debt tend to suffer in silence and just try to pay it off and manage it best they can with their other bills. But at what point do we as a country say, you know, we're not going to tolerate this anymore? Because how bad is it going to get? Like, are we going to allow the amount right now is 195 billion as a nation, and it could go up, you know, if we don't do more. Some people, you know, have smaller amounts. I think the median amount in Maine is between $700 and $1,000. But there are people who have bills of 12% owe $10,000 or more. So sometimes people get very large bills for treatments or joint replacements or things that are add-ons to their bills. And about 18% of people think they'll never be able to pay off their medical debt because they have so much of it. So next slide. There's a kind of a combination of different places it goes. A lot of people will have a payment plan with the hospital or the provider, but some of those accounts get referred to collection agencies, and then it results in medical debt lawsuits, sometimes in bankruptcy. Other people put medical debt on their general credit cards, which is not a great idea because then it becomes treated as just general consumer debt, and you lose all the protections that you would have if you kept it as a medical debt. So in theory, a lot of the people who have incurred it could have qualified for hospital financial assistance, but they were never informed of the availability of the programs, or the programs are often highly complex to apply for, and so that limits the utilization. Another thing we're seeing on next slide is it has really negative impacts on the household. So 63% of people said they had to cut spending on food, clothing, and utilities to pay off their medical debts. 48% used up almost all of their savings, all or most of their savings to pay it off. 11% forced to declare bankruptcy at some time in their life because of medical debt. So the cause, can we go to those causes slide? Just maybe two up. There's basically like 5 different reasons why this problem is as, you know, complicated and difficult as it is. One is people who have chronic illnesses or disabilities or complicated health conditions are more likely to incur medical bills that are not covered by insurance. And also folks who are low income get bills that often exceed their savings and exceed the amount of insurance coverage they have. So lack of insurance coverage and high deductibles. Point number 3 is the high out-of-pocket cost sharing. So even if you have employer-provided coverage, a lot of people have very high deductibles and they don't have enough liquid savings in the household to cover their deductibles and co-pays for themselves and or for their family as a whole. 4th reason is the complicated insurance adjudication process. When you go to a hospital visit, you don't just get one bill like you do when you go to a restaurant. You get like 6 different bills, you know, for the radiologist and the anesthesiologist. And each bill has to go through its adjudication and explanation of benefits with the insurance company. And sometimes it takes months for bills for the provider and the insurance company to agree on the amount to be paid. And so then what happens is some of those bills, the provider just gets frustrated and sends it to collections. So it goes to damage the consumer's credit standing, even though the bill may have already been paid off or gets paid off shortly afterwards. So that's very inefficient, but it also creates a lot of financial harm and debt for consumers. And then the 5th thing is the unfair billing and aggressive collection practices. And this is that, you know, some providers are very quick to send the bills to collections, and then consumers have to pay interest on those debts. And so it makes the debt more expensive. They get lots of calls from the collectors. Sometimes the collectors will go to court and file lawsuits against the consumer, and they can get a court judgments. And most times the consumer is working and doesn't have time to go to court to fight that off, and so they get a court judgments, and they can clean out their bank account, put a lien on their house, or what's the other way?
Garnish their wages.
Garnish their wages, thank you. And if they garnish your wages, you're typically left with very, very little money, like just a little bit over minimum wage. I think Maine has put some guardrails around some of these practices, so it's to your credit. There are some good things that have been done, and we have to kind of chip away at all of these things, but it's a system that is really adverse to, it's very, very painful for consumers to be sued and have these court judgments. Okay, next one. So I know from my work on surprise medical billing, if somebody gets a bill for $500, half the public can't pay it without selling things that they own or borrowing money from relatives. So people are living paycheck to paycheck. Next slide. 42% of households in Maine live paycheck to paycheck because of the other high expenses they have for childcare, transportation, and housing. And so it could be even higher than that. You know, there's certainly middle-class people who are also incurring a medical debt based on the health condition they have or other expenses they have for college tuition and things like that. So, yeah, I just did want to bring out that it's not just a problem that affects really poor people. So while it's really good to have the financial assistance for hospitals at 150 or 200% of the federal poverty line, there was actually a case for making it available higher up the income ladder. I mean, maybe there are ways that hospitals could be required to give a low interest repayment plan and keep it open for people for a longer period of time than just moving the debt out and sending it to collections. And the issue of the medical credit cards is highly concerning, is that there are some medical specific credit cards like Care Credit, which people might have heard of. It's used by a lot of dental offices, vision providers. That one is, we regard that as a dangerous financial product because it uses a deferred interest feature, which is that you often have like a grace period of 4 to 6 months at 0% interest. So as long as you pay it off within the grace period, it's no additional cost. But a lot of people are they've missed the nuance or the details in the terms, and they blow through the deadline. And then once you miss the deadline, the interest is retroactive since the beginning, from the time you had the point of when you had the treatment itself. So those cards have an interest rate of 29 to 30%, and it just seems kind of crazy to me when you have, you know, $195 billion in debt already to be putting more high-cost credit products into the system. We should be looking for a way to to reduce costs, to let people walk away from the treatment counter owing nothing in addition, or if they do owe something, like, let's give them really affordable terms in a decent period of time to pay it off, affordable payments.
And the bill that we talked about earlier, LD 1955, actually tries to do that, like extend payment periods and only have a smaller percentage of people's income. We actually talked to a hairdresser this year who had premature birth of twins. Anyways, the hospital wanted her to pay $13,000 a month over a shorter period of time, or she was going to be sent to collections, which obviously she wasn't able to do. We were actually able to help her in the end, but that's just sort of an example of how egregious some of these payment plans can be for people.
Yeah, and so National Consumer Law Center suggested that payments should be capped at no more than 5% of your income for the month. Like your car payments are not supposed to be more than 10% of your income, because people, you know, spend the 30% of their income for housing and are often much more. I mean, people, whatever the number is, like, people don't have a lot of space in their budget to pay 20, 30, 40% for healthcare bills. So, okay, we could advance several slides there. Let me just look and see what else I have. Yeah, I wanted to talk about credit reports. Could you push it up a little bit more? To the point where, let's look at this Maine map for a minute. So this is where, by county, which counties have medical, dental, or dental bills in collections. And the darker kind of orangey color, that's 21 to 30% of the people in that county have medical or dental bills in collection. The lighter one is like 11 to 20%. But that's like 1 out of 5 people, right? So that's a lot of people with bills in collection.
Yeah, it's an interesting band. That's Piscataquis, Kennebec, Lincoln, and the one that begins with S along the Saginaw.
Okay, next slide. So there's 3 general categories of solutions. One would be make insurance coverage much more generous and make sure that the second point is reduce cost sharing for consumers. So get rid of high deductibles and copays. Not easy to do, probably requires like national help as well as like what the state can afford to do. But that's a good long-term goal, is people should be able to go to get health care, walk away from the facility not owing anything more than a modest copay. Second thing would be reform the medical billing system so that people don't get bills for things that they don't owe. They don't get bills that come in 3 years after the service was incurred. That get bills that they don't have to call Consumers for Affordable Health Care to sort them out, because like people get very complicated bills after the hospital visit. And also the second point is to expand the financial assistance at the point of service, low-cost payment plans. Then the third thing is this category of let's reduce the severity and the harshness of medical debt collection itself. Let's not stop lawsuits, court judgments, and so on. So next one. So I want to talk in particular about credit reports, because this is a way where consumers can really be harmed. We had a guy in New York who had a tow truck business, and he developed cancer, and he had like $50,000 in bills. And eventually he got ahead of the medical bills. It took him a while to dig out of the hole. But in the meantime, his accounts were referred to the collection agencies and to the credit bureaus, and his credit score was so severely damaged he could no longer borrow to maintain the tow trucks in his business. And he lost his business over this issue of the collateral damage to his credit report, put him in the hole. So, next slide. Oh, I'm sorry, the previous one is just pointing out medical debt. Of course, no one wants to incur it voluntarily. It's not like you're going on a cruise or you're buying an expensive guitar or something. It's like you hope that you never have to do this, you have accident or an illness. Okay, so next one. Credit reports were established for credit granting purposes for financial products. So bank loans to buy a home, car loans, credit cards, consumer loans. They were not really established to keep track of people's medical debt. And what they are, the way that credit reports are used now by the debt collectors is a way to get people to pay up on their bill. And so your credit score can really be negatively impacted by medical debt in a way that hurts your ability to earn a livelihood in the rest of your life. Okay, so next one. Medical debt is extremely common on credit reports. It's starting to change because there's now a voluntary agreement not to report any amounts below $500. And they also give you a year to settle your bill, kind of acknowledging how dysfunctional the billing system is. But there are now, you can still have amounts over $500 reported, and those do a lot of damage. So next slide. So in 2023, 2 states, Colorado and New York, passed bills to prohibit the reporting of medical debt to the credit bureaus for the amounts over $500. And this Consumer Financial Protection Bureau has announced it's probably going to do a rulemaking to ban it in all 50 states, but this might take like 3 to 5 years. Like, I don't know exactly how long it might take. So we are encouraging other states to consider doing this type of a bill in your state. The reason, and CFPB has issued an advisory opinion saying that states have the authority to restrict credit reporting for certain types of things based on their local economic conditions and their policy preferences. So they believe that you have the authority to do it, and they also think that it's a good thing from a policy perspective to do, because the medical debt within the credit reporting system introduces a lot of noise because of all the billing inaccuracies that I mentioned. And also, they have not found it to be that predictive of risk that you'll not pay off your car loan or you will not pay off your mortgage. The consumer is still incented to pay all of those bills. And they have argued that it belongs out of the credit reporting system, and they have been moving to also remove it from other federal loan programs like the VA and Small Business Association administration loans. So we hope that this is a change that we might be able to bring about as a country. And that would reduce some of the collateral damage that people get from a medical debt. It would allow them to get back to economic health after you've been in the hospital with an injury or an accident. Let's give that person a break and help them keep their car, help them keep their house. So that's the idea behind this type of a bill. And we encourage people to check your own credit report. Annualcreditreport.com is the one authorized site where you can get a free credit report all year long from each of the 3 major bureaus with no additional fees. And you'll often find when you check your credit report, there will be accounts or debts on there that you may not recognize. So it's a good thing to do for your own financial health to check that. But we did a poll at Consumer Reports. We found about 1 out of 10 people found a medical debt on their report that they didn't even know about. that there might be a bill that was sent to collections that you never even saw, and now is being reported as a debt account. So it's just a good thing to do every now and then to check your own report. So those are some ideas that we have, but we're very excited about being able to work together, and I want to support everything Consumers for Affordable Healthcare is doing here in Maine to help protect consumers.
That's great. Appreciate Chuck coming today. He was supposed to fly into Portland, but he got rerouted to Bangor last night because of the weather. So
well, the other thing I want to say is we're as a consumer organization, we're big supporters of being able to have a hotline that consumers can call to help with enrollment and billing problems. We have like a really good one in New York also. But many states have no program whatsoever, and so like if you have run into problems with billing or insurance coverage, you need to file an appeal. People want to be able to talk to someone on the phone about those things. They don't want to just go to a website and be told what to do by some insurance company hack. So we think this is really a good program that you have, and hope it can be sustained and expanded for many years to come.
I appreciate that. Yeah, we do hear from people who are like, oh my God, not only did you answer the phone, but you listened to me. It's like they feel like they won the lottery in some regards, just like we do having you here today. So.
Well, I mean, and I should say, you can get good information from the insurance company. I mean, I like thinking insurance companies have good websites, but not a lot of people use them. But my point is, people often need someone to hold their hand when they have a problem, and that's really, and they need somebody who understands the law and understands insurance, and so I think that's a really tremendous service that you have.
Yeah. You talk about complicated billing.
Yeah.
And I know that Valerie has helped we have our associate director has a law degree, and she helps with appeals, and sometimes these bills are just impossible to decipher what they mean, what you're billing for, date of service, what's paid, what's not paid. And I know that you've spent, especially on one case recently, hours kind of sifting through those bills. It's almost like a part-time job for some people.
Well, they have these very complicated codes, right? There's these people who have a whole profession of medical billing and coding, and preventive services are supposed to be free, but they're often miscoded by the provider. So sometimes people are overpaying because the billing system isn't working correctly.
Question. Once you get the bill, you try to figure out what it means. Like that's only part about it. It's really, really difficult to get itemized bills from hospitals that they establish. It's the first challenge, and then sorting it out and figuring out what everything means is always.
Yeah. We proposed in New York that a law that would say when you go to the hospital, you get one bill for a hospital visit that would be consolidated, inclusive of all the services. And the hospitals told us, no, that's completely impossible. We can't do that. So, but we were saying, like, when you go to a restaurant, you don't get a separate bill from the salad maker and the pastry chef. It's like one bill. And so it is, and I often say too, when you get bills after a hospital visit, put them in a pile and let them marinate for a few months, because it's only the beginning. The insurance company hasn't gone through it yet either, and there's going to be 6 months of arguments between the providers and the insurance company. So that's not really the consumer's fault. Like, that's society's fault. Like, we have to do something to fix that.
Well, thanks. And the other thing that I was surprised to hear about upstairs when we were with the press was that so many people have medical bills on their credit reports and don't unknowingly.
Yes.
So that's something that we should
Something to
think
watch
about.
out for.
Yeah.
And some of those are in error. That happened to me where they just didn't know my insurance company, and I got it off, and I don't understand. That should have been covered. And even once I got the damage, once I got it taken off of my credit report, my score still didn't go back up to what it was before. And that, that's bad news for a lot of people. Luckily, I wasn't about to go get a car. I was all set. So.
I have a question about the medical test labs and diagnostics. That number seems, she passed out a PowerPoint, 74% in Maine. And I guess what's the national landscape around that, and what is happening with that?
It was 74% for
74% of people with medical debt reported that the bill originated from a
A lab or diagnostic facility?
Yeah.
Wow, I have to dig into it, I don't know off the top of my head, but
There's
that's.
a lot of outsourcing, there's a lot of outsourcing from hospitals.
Yeah,
So that, I'm guessing that could be it. And people, even though they get their blood drawn in the hospital, they're not aware that it's being sent out of the hospital.
so there's also been, a lot of consolidation of ownership of facilities, right? And that's why we started to get more of the facility fees, is that many hospital systems have been buying up physician practices, but also the freestanding diagnostic facilities. And that, so sometimes you're also getting an additional facility charge for visiting diagnostic facility. And if you're really a savvy, skeptical consumer, you could go on your insurance company's website and try and find out which ones are in network or which ones might be able to get the test at lower cost. But most people are just gonna do what their provider suggests that they do, which is often go to the hospital's own, MRI. And so those can be expensive for people, so it's, it does seem very complicated to me as to like find the one where the insurance company has negotiated the lowest rate, but also negotiated the rate where you get the lowest cost sharing. Yeah, and it's not always simple to find those facilities.
They have to compare that to the.
Call and ask, because I went and used the Compare Me website to find an imaging facility, made an appointment there, and it turned out that they had subcontracted the imaging to a hospital.
Yeah.
So I ended up paying the hospital rate.
Yeah.
So they were like, oh, well, that's our rate, we do have our own imaging in a different town, but in this town, it's not the same.
Right. So
When you try, it's like.
Right, so you didn't find your research process was rewarded then, right?
No.
Yeah.
Maybe, if people don't mind, just so Chuck has an idea of who's here, because it's an interesting group of folks. If you just want to introduce yourselves real quick.
We already met, but I'm Kaylee, I'm with Kate.
Okay.
Kate Envy and I'm with Consumer for Affordable Health Care as well.
Ann Sedlak, I am the new Director of Advocacy of the Maine Medical Association, and we also work with the Maine Osteopathic Association.
Lisa Nolan with the Healthcare Purchaser Alliance. We work with employers
Oh, fantastic.
to promote affordability.
And I'm Trevor Putnaki, also I'm with the Healthcare Purchaser Alliance. And we had a project actually with Consumer Reports probably 6 or 7 years ago.
Oh, okay.
The doctor project where we were.
Yeah, like choosing wisely or.
Exactly.
Yeah. That's really good.
I'm Rachel Collimore. I'm the Consumer Assistance Program Manager at Consumers for Affordable Healthcare.
Mike Tipping, I represent Senate District 8.
Senator Tipping.
I'm Megan Hannon, I'm with Maine Community Action Partners here. And I'm Helen Roy, I'm also with CAHC, I'm the Education and Outreach Coordinator. I'm Kathy Fenimore, I'm with Senator Collins' office here.
And I'm Laura Harper, I'm a Senior Associate with Mooseridge Associates, and I'm a contract lobbyist, and I represent CAHC in the State House.
I'm Mark Mallon, I am a representative from District 133, which is part of Biddeford.
Ernie Davis, Northeast Director, Government Affairs for the Leukemia Lymphoma Society.
So thanks all for being here today. I don't want to put you on the spot, Senator Tipping, but do you want to, since you're here, do you want to just, I know people have asked about your bill number. Do you want to just chat about that for just a second?
Sure, I just came because someone said there was cake. Actually, not how it was spelled. But yeah, 2115 is a bill that you could probably explain better than I can. But it's relatively short, and it just says that if a healthcare provider is going to sell your medical debt to a collection agency, usually for pennies on the dollar, that they first have to at least give you the opportunity to buy it at the same rate.
I love that, by the way. We tried to work with, what was that group called?
RIP Medical.
RIP Medical Debt. We have been trying to see if we could buy Maine debt on the market, because you could buy them again. And there was no debt available on the market. We had a relationship where they just automatically sell it without seeing it.
That's interesting.
That would be great.
I wonder if we should, think about a third-party provision of that as well.
Yeah.
Anyone should.
I mean, I think a lot of nonprofits, the RIP medical debt is funded mostly by churches and civic organizations. Although they just signed on like 30 municipalities who have decided to use tax dollars.
thanks for joining us and for helping with upstairs, really appreciate it. And any questions for Chuck while we have him here?
Thank you for coming, really interesting.
Thank you.
And sorry we had so much competition today.
Yeah, you know, you can never tell
But we
what's
worked,
going on.
the press worked out good, because I was nervous about
Yeah,
that, so
it was
yeah, we had
good.
good turnout for that, so that was great.